Planning to get. This presentation is partial fulfillment for the requirement of Nursing 5309, Teaching and Learning Theory, Strategies and Evaluation. Today I'm going to use two learning strategies to talk about problems that we've encountered at work. The first one is going to be a problem-based learning, and then the next one is going to be concept mapping. Problem-based learning is a teaching approach that students will be engaged in using collaborative group work to solve problems, and it's also a strategy that we can use to collect information that is required to solve the problem that we're going to discuss this afternoon. The next approach we're going to use is concept mapping. With concept mapping, metacognitive tools such as critical thinking will be used as the learners will be using their own thinking and reasoning as they form a relationship among the factors identified in the problem. What are the objectives of this particular presentation today? Nurses are able to apply principles of evidence-based nursing to use critical thinking to prioritize patient needs and implement care that is appropriate for the patient. Nurses will appreciate the value of assessing the outcomes of the scenario in assuring the quality and the nursing profession and the quality of care for patients. Nurses will be able to collect and organize the clinical information available, such as chat review, dialogue with the patients, and a physical assessment as we talk about the patient. This presentation is going to be directed to the rapid assessment team nurses who take care of patients in emergencies within the tower. The nurses will work together as a group. They will use critical thinking judgment. They will use nursing ethics and creativity. They will use proper delegations and use initiatives. So here we begin. This is the problem. The scenario is that the nurse received two patient-related calls. One of the calls was about a patient who had suddenly broke out a rash all over his torso, his arms, and his neck area. And while assessing the patient, another call comes in about a patient with an elevated blood pressure of 200 over 114. The blood pressure patient was sent back to his tank. This resulted in the unit manager being called to the scene because a patient with a blood pressure of 200 over 114 should not be dismissed easily. We're going to brainstorm about the patient. Here's what we know about the incident that happened. The patient with the allergic reaction was taken care of, the provider was notified, orders were received, and he had an order for a Kenalog shot, and he also had an order for Benadryl. The Benadryl was given to him from the 60s, but the Kenalog was not available in the 60s, so we had to go to the basement to pick up the Kenalog. So we came back and we gave the patient Benadryl. So we were waiting for the Kenalog to be ready by the time it was picked up. So when the patient comes up to us with a blood pressure of 200 over 114, we sent him back to his tank. We did a chat review on him and we found that he had received two blood pressure medications that morning, but they had missed one of them. Even though his blood pressure had not changed much with the medications that we gave him, still his blood pressure remained high. So now we want to see what we could have done differently instead of sending the patient back to his tank and not just, dismissing him like that. So I'm going to give the class 2 minutes. Since you know what happened, we know what patients were there and what we have done for the patient. We're going to give you guys 2 minutes and think about the problem and see how you could have handled it differently instead of sending the patient to the tank. Okay, class, we're back. So we're going to start with Jennifer. Jennifer, what would be your first course of action with the patient with a blood pressure of 200 over 114?
I will recheck the blood pressure and also have a dialogue with the patient to see if there is some stress going on. We'll also find out from the patient if this is the first time the blood pressure has been elevated.
Yeah, that's a good input there because we're checking the blood pressure and maybe talking to the patient. There may be something going on in the tank with the patient that is making the patient upset and causing an elevated blood pressure. So if the patient is telling us that nothing is going on, he's been doing fine and he has no stress going on in his life, we want to make sure that we're notifying the doctor to see what we can do about it. So Mary, what did you do about it?
Well, we have talked to other nurses about getting involved, and then we would have somebody pick up the medication from the pharmacy and make sure it was a team approach, and then we would delegate on the process.
That's good. Delegation is a good process because if the nurse in question had sent someone to pick up the Kenalog from the pharmacy, he would not have to, easily dismiss the patient going back to the tank. So someone else could have picked up the medication from the pharmacy. Someone could have been monitoring the blood pressure, and the nurse could have been calling the doctor to report the condition of the patient after the fact review. So Sarah, what do you add to the scenario?
Well, we discussed calling the doctor about the current situation, given the patient's history or switch roles with, Jennifer, who has been dealing with the patient, and I'll continue to monitor the patient for any change in condition.
Yeah, that was a good call in judgment because Jennifer has been dealing with the patient. She knows exactly what's going on with the patient. So she calling the doctor would have the correct information to give about the patient. So that was a good collaboration of efforts. So together as a group, we were able to come up with ideas as to how we could handle the situation differently. So next time we do not have a problem or we cannot send a patient to the tank with a blood pressure of 200 over 114. That could have caused him to stroke, and we don't want to take those chances. So this is a great discussion, and I hope everybody has learned from it. And every once in a while, we're going to be doing this so that we can review scenarios so that we don't repeat the same mistakes that have happened. Thank you very much for your audience.
Thank you.